The topic of the tutorial is submandibular region. I, Dr. Alpana Kesar, will be covering this topic under the following subheads: muscles in the submandibular region, submandibular salivary gland, which will be discussed under the following subheads: location, shape, parts, relations of the gland, duct, nerve supply, blood supply, and clinical anatomy. Sublingual salivary gland and submandibular ganglion. Location of the submandibular region is between the body of the mandible and the hyoid bone. The region that has been marked here is the submandibular region. This is the submandibular region, and the contents of this region are suprahyoid muscles, namely digastric, mylohyoid, hyoglossus, stylohyoid, and geniohyoid. Two salivary glands are present, and they are submandibular salivary gland and sublingual salivary glands. Parasympathetic ganglion, namely submandibular ganglion, is present in association with lingual nerve. Suprahyoid muscles. In suprahyoid muscles, this muscle is stylohyoid. Stylohyoid muscle takes origin from the base of the styloid process, and it gets inserted into the body of the hyoid bone. The muscle pulls the hyoid bone upwards and is innervated by facial nerve. Digastric muscle. The word digastric means two bellies. Digastric muscle has two bellies, namely the anterior belly and the posterior belly of digastric. This is the anterior belly of digastric, and this is the posterior belly of digastric. The anterior belly of digastric take origin from the digastric fossa, which is present at the lower surface or border of the body of mandible. The posterior belly takes origin from the mastoid process on its medial surface and from the mastoid notch. The anterior belly from the digastric fossa and the posterior belly from the mastoid process both will descend down towards the body of the hyoid bone. Both the muscles get inserted into the common tendon. This common tendon is held in place with the help of connective tissue fibers that form a sling or a pulley around the common tendon. This pulley is attached to the body of the hyoid bone. When the muscle contracts, it pulls the body of the mandible downwards, thus helping in the opening of the mouth. This muscle also helps to elevate the hyoid bone. Digastric muscle has dual innervation. That is, anterior and posterior bellies are supplied by different nerves. Anterior belly of digastric is supplied by mylohyoid nerve. Mylohyoid is a branch of inferior alveolar nerve, which is a branch of mandibular nerve. The posterior belly is supplied by facial nerve. Hence, the anterior and the posterior bellies of digastric are supplied by trigeminal and facial nerve respectively. Mylohyoid muscle. Mylohyoid muscle, which forms the floor of the mouth, is also called oral diaphragm. Its origin is from the mylohyoid line, which is present on the inner surface of the body of mandible. Insertion of mylohyoid is the lower fibers get inserted in the body of the hyoid bone. The upper fibers get inserted into the midline raphe. This midline raphe is formed by intersection of the fibers of mylohyoid muscle on right and left side. The action of mylohyoid muscle is elevation of the floor of the mouth, which takes place at the time of swallowing. It also helps in the elevation of hyoid bone. Nerve supply of mylohyoid muscle is from inferior alveolar nerve. Inferior alveolar nerve, just before it enters the mandibular foramen, gives nerve to mylohyoid, which supplies mylohyoid muscle and gives a branch to the anterior belly of digastric. Inferior alveolar nerve is a branch of mandibular nerve. Geniohyoid is a ribbon-shaped muscle. Its origin is from the inferior genial tubercles present on the inner surface of the body of the mandible. Insertion is into the body of the hyoid bone. The action of the muscle is when the hyoid bone is fixed, it helps to pull the mandible down. Thus, it helps to open the mouth. When the mandible is fixed, it helps to elevate the hyoid bone. The innervation of geniohyoid muscle is by branch from anterior ramus of C1. The fibers are distributed by hypoglossal nerve. Submandibular salivary gland. Submandibular salivary gland is a seromucous gland. This means that it has both serous and mucus acini. Hence, its secretion is mixed. There are three salivary glands, namely parotid, submandibular, and sublingual. Submandibular salivary gland is smaller than parotid but larger than sublingual salivary gland. Submandibular salivary gland is of the size of a walnut. It is a J-shaped gland or a hook-shaped gland. It hooks or curves around the posterior border of mylohyoid muscle. Thus, mylohyoid muscle divides the submandibular salivary gland into two parts: the larger superficial part and the smaller deep part. The superficial part of the submandibular salivary gland is located in the anterior part of digastric triangle. This is the anterior and the posterior belly of digastric that forms the boundaries of the digastric triangle. The anterior part of this triangle contains the superficial part of the submandibular salivary gland. The superficial part has three surfaces. They are the lateral surface, the medial surface, and the inferior surface. The lateral surface of the submandibular salivary gland is this. This is the lateral surface of the submandibular salivary gland, which is related to the medial surface of the body of the mandible. On the medial surface of the body of the mandible is present a depressed area called submandibular fossa. So, the lateral surface of the submandibular salivary gland is related to the submandibular fossa of mandible, and here the facial artery hooks around it to enter the face. The medial surface of the submandibular salivary gland, which is this surface is related to mylohyoid muscle. Along with it, it is also related to hyoglossus and styloglossus muscles. Inferior surface of submandibular salivary gland, which is this, is also called its superficial surface, and the superficial surface or the inferior surface is related to skin, superficial fascia, platysma muscle, deep fascia, and cervical branch of facial nerve. This is the submandibular salivary gland, which hooks around the posterior margin of the mylohyoid muscle. This part of the submandibular salivary gland is superficial part, and this is the deep part of the submandibular salivary gland. The deep part lies on the superior surface or the upper surface of the mylohyoid muscle, in the floor of the mouth, along with the sublingual salivary gland. So, the deep part of the submandibular salivary gland and sublingual salivary glands lie between mylohyoid muscle below and the mucosa of the floor of the mouth above. The relations of the deep part of submandibular salivary gland are: inferior to the deep part is present mylohyoid muscle. Superior to it or above the deep part is present the mucosa of the floor of the mouth. Medial to it is present the root of the tongue and the hyoglossus muscle. And anterior to it is present sublingual salivary gland. Submandibular gland duct. Submandibular gland duct is 5 centimeters long. It emerges from the medial surface of the superficial part of the gland. It then pierces the deep part of the submandibular gland and traverses through it. After that, it emerges in the floor of the mouth. It passes forwards in the floor of the mouth to open on the summit of a small sublingual papilla just besides the frenulum of the tongue. Lingual nerve loops around the submandibular duct, crossing first lateral, then inferior, and then medial to the duct. Because of this intimate relation of the lingual nerve with the submandibular gland duct, care must be taken while performing surgeries on the submandibular gland duct, as at the time of removal of stones from the duct. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Blood supply and lymphatic drainage of the submandibular salivary gland. Arterial supply to the submandibular salivary gland is by the facial and lingual arteries. Venous drainage will be into the accompanying veins, that is, the lingual and the facial veins. Lymphatic drainage is into submandibular group of lymph nodes, and from there the lymphatics will go into the deep cervical lymph nodes, especially the jugulo-omohyoid lymph nodes. Innervation or nerve supply of the submandibular salivary gland. The sensory innervation of the submandibular salivary gland is by lingual nerve, which is a branch of posterior trunk of mandibular nerve. The secretomotor or parasympathetic pathway begins in the superior salivatory nucleus in the pons. The preganglionic fibers pass into the facial nerve and then into its cauda tympani branch. Cauda tympani nerve joins the lingual nerve, and the fibers traveling through the lingual nerve relay into the submandibular ganglion. The postganglionic fibers arising from the submandibular ganglion are secretomotor to submandibular and sublingual salivary glands. For submandibular salivary gland, the postganglionic fibers from the submandibular ganglion pass directly into the gland. But for the sublingual salivary gland, the postganglionic fibers arising in the submandibular ganglion pass into the lingual nerve, travel along with the lingual nerve to reach the sublingual salivary gland. Clinical anatomy of submandibular salivary gland. In case of malignant tumors of the submandibular salivary gland, it may require excision of the gland. During the excision of submandibular salivary gland, incision must be placed 2.5 centimeters below and behind the angle of the mandible. This is done to preserve the marginal mandibular nerve that crosses the angle of the mandible. Marginal mandibular nerve is a branch of facial nerve that is motor to the muscles of the lower lip. If this nerve is damaged, it will result in paralysis of the muscles of the lower lip. Silolithiasis is formation of stones in the submandibular salivary gland duct. Formation of stones is more common in the submandibular salivary gland duct as compared to parotid because 1. The secretions of the submandibular salivary gland are more mucus, and 2. The secretions from the gland travel in the duct against the gravity. Whenever there are stones in the submandibular gland duct which have to be removed, care must be taken not to damage the lingual nerve, which is intimately related to the submandibular gland duct. Sublingual salivary gland. Sublingual salivary gland is located in the floor of the oral cavity. It has mylohyoid muscle present below it and mucosa of the floor of the mouth above it. Lateral to it is present sublingual fossa on the medial surface of the body of mandible, and posterior to it is present the deep part of submandibular salivary gland. Sublingual salivary gland has about 15 ducts which emerge from the gland and open directly on the floor of the oral cavity. Blood supply of sublingual salivary gland is by lingual and submental arteries, and veins follow the same course as arteries, and the veins draining blood from the gland is lingual and submental veins. Nerve supply to the sublingual salivary gland is same as the submandibular salivary gland. Students who are exam ready should be able to answer the following questions from the topic submandibular region. Describe the submandibular salivary gland under the following heads: location, paths, relations, secretomotor pathway of the submandibular salivary gland, and submandibular gland duct. Students should be able to write a short note on the sublingual salivary gland. Students should also be able to describe the suprahyoid muscles under the following subheads: origin, insertion, nerve supply, and action. Students must know that the mylohyoid muscle is also known as the oral diaphragm. Some more questions that may be asked from the topic are: why are submandibular duct stones formed more commonly than parotid? Which nerve is related to the submandibular duct, so as the care must be taken not to damage the nerve at the time of removal of submandibular duct stones?